Dr. Agtarap and a long-term care provider here at Olympia Orthopaedics. I've been with the group for now 22 years. Over the last 5 to 10 years, have subspecialized in knee replacement and have had a big role in hip replacement prior to that. So joint replacement has come a long way in the last few years, and some of those changes are well evident in what we've done here at Olympia Orthopaedics. One thing that we found very important in the last couple of years is a new approach clinically that we call shared decision making. That primarily is in interaction and a process between the patient and a provider regarding treatment options as we move forward with treatment of total hip and total knee problems, primarily arthritis. So what that means is when a patient enters our practice and becomes one of our patients, we develop the most important thing, which is develop their diagnosis. And if it is arthritis and we go down this pathway towards joint replacement, then a shared decision between the patient and the provider is really important. So I'm often asked, well, what does that mean? Well, it's something that actually occurs over many visits as we get to know each other. It begins with answering the patient's questions regarding their diagnosis, and then ultimately treatment options. We want it to be feedback both ways, where myself as a physician explain to you what your problem is, and then you share with me what you hope to get out of those visits and those treatment. That begins with conservative treatment for your arthritis, and ultimately surgical discussion is entertained. That surgery may be something as simple as an arthroscopy all the way up to a joint replacement. And it's at that point when we have some real decision making to carry out, because a big decision has to be made on moving forward with joint replacement, and that takes this process to the next level. As we're talking about surgeries, one thing that often comes up after discussion of medicines and injections and therapy and bracing is, am I a candidate for a joint replacement? So part of that is discussing the pros and cons of a joint replacement. What does that mean? What's your expectations? And ultimately, is it indicated with your problem? At that point, we may talk a little bit about the joint replacement, either a hip or a knee. What type of implant is it? How long have we used it? What's its clinical usage in scenario? And that describes the vendor, the type of implant. It may be a discussion whether you're a candidate for a partial or a full knee replacement. At some point, you have to have a really good understanding of that surgery. We have to be able to answer your questions, and you have to be confident with the care we're providing. As that point we move forward, we're going to talk about the lifespan of the implant, what we expect out of it, how long is it going to last, clinically how long I've used it, how long has it been around, how many surgeries has your surgeon provided, what is their volume and what is their experience with that implant. So once you as a patient decide to move forward with joint replacement, that really takes this process to the next level, and it's really preparing you what we like to call fitness for surgery. And so we engage in a preoperative process to make sure you're stable medically. There's sort of healthcare parameters we want to evaluate and share with you. And that process not only happens preoperatively, but we discuss the experience during surgery, after surgery, your recovery, and all the way through the expectations that we want to keep an eye on you for even up to 1 to 2 years after the joint replacement. That follow-up includes not only clinical visits and x-rays, but there's a real need and understanding clinically for patient-reported outcomes. So we're going to ask that you be engaged in your post-operative care and give us feedback on how we're doing and how you're doing. Part of this process might include medical or surgical specialty consultations. We get lab data, we might have you see a cardiologist, and so you have to agree to get through that preoperative process so that at the other end you're happy with the results and you've done well. Finally, that's preparing you for the last little bit of surgery. It's finally sitting down, going over the informed consent. Do you understand the risks and the benefits? There's surgical, technical, anesthetic risks that you need to know about before we move forward. Finally, there's the housekeeping that each one of us has to do before we engage in this, and that's a health care directive, and making sure you have a power of attorney, and making sure the final details of like a living will are addressed, or at least we can answer any question. During your course of recovery, in the past, there was extended stays in the hospital, often a nursing facility. In today's world, that's rarely ever needed, especially since there's a push for outpatient knee replacement and hip replacement. Part of that is to have not only a patient engaged, hopefully with a family member or someone close to them, we like to call a coach. So we designate somebody in their life to allow them to assist them through this process. Not only the preoperative workup and evaluation, getting to postoperative appointments, and helping them structure the details that they're going to have to go through for the joint replacement. And so the coach is a big part of this process.